Meanwhile, anonymous employees say the state health department is pulling back on telling people to get vaccinated. That's according to a report out today. Rachel Hanley has what the department is and isn't saying about the claims.
Friday morning, NPR.org published this article. Reporter Rosemary Westwood says she heard from 4 Louisiana Health Department employees who told her they were called into meetings this fall. In them, they say department leaders told the employees not to promote COVID-19, flu, or Mpox vaccines anymore.
There can't be social media, there can't be vaccine events, there can't be press releases, there can't be any other sort of public-facing encouragement of these vaccines.
They say they weren't given any kind of policy in writing.
For me as a reporter, what that means is it's more difficult to report this story, but for them what it means is it's more difficult to understand what the limits are and how far this policy extends and what they can and can't do.
Westwood kept the employees anonymous since they told her they were worried they could lose their jobs. We reached out to the LDH about the claims. It didn't confirm the exact details of what the employees said they were told, but it did say that as the country continues to shift out of the pandemic, the department is reevaluating its messaging around vaccine promotion. This time last year, the LDH Instagram page posted multiple reminders to get the flu shot. This year, there were none. One post is specifically about preventing the flu, and it doesn't mention vaccines at all.
When I first saw the article, I was really concerned.
WWL medical correspondent Dr. Corey Hebert says if the employees' claims are true, it could have an even wider impact than just immediate vaccine numbers.
If our state is saying that we don't really think vaccinations are important, then it will make a lot of people feel like, well, maybe vaccinations aren't important.
The shift is also coming at a critical time. Right now, Louisiana is leading the country in flu cases. About 1 in 10 flu tests in the state are coming back positive, and that's about twice the national average. The employees told Westwood they're worried the alleged policy could make that worse.
What they're really afraid about is that more people are going to get sick and that more people will die, and that came up in every conversation I had.
Vaccines are available, though. In a statement in response to the article, the City of New Orleans Health Department says they're usually free of charge through your doctor, most local pharmacies, or by visiting vaccine.gov. Rachel Hanley, WWL Louisiana.
Well, the statement from the LDH goes on to say that the state surgeon general has expressed personal concerns about the efficacy and safety of the COVID vaccine. It also claims the flu vaccine does not prevent one from getting the influenza virus. That's something Dr. Aber says is contrary to decades of data. You can read the full statement in a story on our website.